ABC News, America's news leader.
Good evening. Imagine this. You are pregnant, or your wife is. The fetus is 4 months old, and you are able to look inside the womb and see your baby. And what you see is deformed, crippled, and will be for life. What would you do? Well, a few years ago, the question wouldn't exist because the technology to see into the womb didn't exist. Now it does.
Here's top of the baby's head. The black hole here being the baby's eye socket. Come down to the jaw, the baby's jaw. Then as we come around, come through the baby, you can see the spine and the neck region being these two parallel lines. We follow the spine down.
Debbie Slavic is doing something astonishing. She is looking inside her body, watching her unborn baby.
Chest region, because you can see the ribs, these very fine white lines.
It's done with high-frequency sound waves, a sort of sonar that shows the tiny fetus right there on the television screen.
You can see the heart beating within the chest. Okay. There's a hand. There's a thumb.
Yeah.
There's a thumb.
What brings pregnant women to this laboratory just outside New York City to be probed with scanners and syringes? It's not curiosity. It is the agonizing fear that something may be terribly wrong with their babies.
Don't help me.
Okay.
I don't need help.
Okay.
Her name is Rachel Erickson.
In you go.
She is 5 years old, and she has what doctors call spina bifida.
Okay,
That's a medical term for a hole in the spine. What it usually means is paralysis below the waist, no control over bladder or bowel functions, and often mental retardation. Rachel is lucky. She did not suffer brain damage, but every 3 hours, her mother, who adopted her, must insert a tube to drain her urine. That is Rachel's life, and this is why. Look through an electron microscope at the fetus of any creature with a backbone, and this is what you will see. First, a tiny plate appears and begins to curl upward. This is the neural tube, which will form the brain and the spinal cord. By the 30th day of pregnancy, before the mother even knows she is pregnant, the tube must seal itself perfectly from top to bottom. Usually it does. But once or twice in every 1,000 babies, it doesn't. There is a gap, a neural tube defect. If it is at the top of the tube, the brain will never develop. The baby will almost certainly die soon after birth. If the defect is near the bottom of the neural tube, the baby can survive, but it will face a life which at very best will be severely handicapped. It will have spina bifida. It's in this medical complex, it is here in this laboratory that you can find the technology and the people who can now determine with almost 100% accuracy whether a baby will be born with this fatal or crippling defect. It is a major advance in medical science, but along with the new knowledge come new questions, questions the doctors can't answer. Only the parents-to-be can decide whether to have a baby who they know in advance will be crippled. This laboratory tests blood samples of thousands of pregnant women, looking for suspiciously high levels of a protein called AFP, which may be leaking from the baby's neural tube. If too much AFP shows up, the parents are called to the lab, and their ordeal begins. Aaron and Jim O'Donnell have 2 healthy little girls and a danger signal from the baby on the way.
There are actually 4 different causes, possible causes, for the blood test to be elevated.
Even at this stage of the testing, the chance that the fetus has a neural tube defect is relatively small, only 1 in 20. But the fear is great. Jim O'Donnell asks the crucial question.
Other than having the option to terminate the pregnancy, what's the benefit of finding out at this point in pregnancy?
To prepare yourselves. There are certainly many, many couples who would not want to terminate a pregnancy no matter what. And that's fine, you know, but at least they know what's coming, they know what to expect, they can arrange to deliver the baby in a place that is geared to take care of infants with special problems.
The moment of truth, of greatest anxiety for parents, comes next when the fetus is scanned with an ultrasound device.
Baby's head size is 5.5 centimeters, or about 2¼ inches. And measuring the baby's thigh bone.
In diagnosing spina bifida, doctors must know the exact age of the fetus.
Approximately 3.7 centimeters, and 3.7 centimeters is exactly 22.5 weeks. So both the baby's thigh and the baby's head are appropriate for your dates, which are 22 and a half weeks. Right.
The key element in scanning a fetus is the ability to interpret the images. Dr. Roger Boehm has brought this analysis to a high art.
What we look for is to demonstrate that the formation of the spine is in parallel. And you can see one set of white dots parallel to the other set of white dots, representing that, at least in this view, the fetal spine is okay, normal, without evidence of a defect in its formation.
Now we're looking at another spinal column.
That's correct. This is an abnormal spine. Although the lines in this fetus begin as parallel structures, they suddenly diverge just below the rib cage in this fetus. And this divergence that we see represents the abnormal spine, the spina bifida in this case.
That is an open spine.
That is an open spine.
Those couples, like most tested at the laboratory, went home with good news. Their babies had no spinal problems, no defects. But then there are those who come home with the news they had feared. And 4 years ago, it happened to you, Joe and Ann Barbera.
I had always believed that abortion was wrong. I would never move on the subject, but it just shows that when you're faced with the problem, it has to...
The circumstances change.
That's right.
They really do.
You can't judge anybody else. It has to be for, just for you.
10 years ago, the Barberas would not have had a choice to make because there was no way to test the fetus. The screening program was developed by Dr. James Macri after one of his children was born with spina bifida. If a mother pushes you and say, Dr. Macri, you have this experience, what would you counsel me? What do you answer?
Generally, families that do come to us are not aware that my child has been affected with this problem. And I think that that's probably been good in the past because they might hang, as you say, on each and every word that I say as a signal of what they ought to do. We have to remain as undirective, as unbiased as we possibly can. We have to present the facts, but the final decision as to what is to be done can only rest with the family. And we are very, very careful about that, I assure you.
Roll over. Roll, roll, use those muscles. Good. Good, now sit up.
Spina bifida children can and do triumph over their condition. With specialized training and surgery, many become strong, productive adults.
Good, relax.
Let's see.
For each child, the cost can run to thousands of dollars a year, financed sometimes by a family's private insurance, sometimes by the taxpayer through Medicaid.
Coming up?
Yep.
But the decision whether to have a spina bifida baby must include all the costs in pain and limitation for the child and the impact on family life.
True. Now you see you getting close to the edge, right?
Carol Erickson and her husband didn't have to face the question of aborting a spina bifida fetus. They adopted Rachel 3 years after she was abandoned by her natural mother in Nicaragua.
And it's not a terrific thing to do. It's just that kids are kids. And I never considered, adopting her as being a marvelous thing because she's handicapped. To me, she was a little girl, and when I saw her picture, I knew she was going to be my little girl, and that was the, that was the end of it. It was a decision that we made, all of us together. And if it was the fact that it was my child that I was giving birth to, the decision would have been the same. I myself could not have an abortion.
Bless us all right.
The Barberas are Catholic. But 4 years ago, when Ann was pregnant and the fetus was diagnosed as a spina bifida baby, they made their decision. What was the one factor that weighed most importantly with you in deciding to have the abortion, not to have the baby?
I think it was just the fear that I wouldn't be able to take care of the child properly, and I wouldn't be able to devote enough attention to Bridget. And I knew that if we had the baby and she lived, and we did take her home and try and take care of her, I wouldn't have other children.
If this method of screening for spina bifida didn't exist, and you had had a child with the disease, would Branwen be here now?
No. No,
Her sister?
No, I don't think so. If they couldn't say to me, yes, you're going to have a healthy child, I wouldn't take the chance.
On the one hand, there is a child who is not here in this family because it had spina bifida, and you made a decision not to have it. And by the same technology,
There are two.
Branwen is here right now.
And Justine. as well. There are 2 others.
Most of the doctors we consulted in preparing this report agree with the Barbera's decision. They would advise not giving birth to a spina bifida baby. And how are the parents deciding?
The great majority certainly do, with this information, do elect to terminate their pregnancy.
Great majority means what, 90%?
I would say at least, if not more, yes.
More than 90%.
I would think so.
What do you think this placenta problem is?
The decision to have a spina bifida baby or an abortion is difficult, but at least it is being made on reliable medical information. Dr. Macri says no healthy fetus has been aborted through a misdiagnosis at his center. But now blood testing for birth defects may spread nationwide. Dr. Macri has a nightmare that even though a neural tube defect is the least likely reason for a high AFP count in the blood, women who have it may panic. In plain language, that a woman would have an abortion when it wasn't necessary.
Precisely. Unless governing authorities, such as the FDA, do come out with real guidelines, with viable restrictions, which will ensure for the safe and effective spread of this testing, we could possibly see one of the largest medical disasters this country has ever recognized.
The Right to Life movement doesn't object to Dr. Macri's testing program because, as we saw, it can promote life. For example, remember when we saw expectant mothers looking inside their wombs? Well, time goes by, and we thought you'd like to meet one result. Matthew David Ierardi, born April 1st, and as the testing indicated, born healthy. Of course, sometimes the news is bad, and again, when it is, the most basic of human questions is raised. And 90% of parents are answering it with an abortion. Time now for your comments. Last week I did a report we called The Terrible Choice. It was about a new medical technology that can tell whether a fetus inside the womb has a defect known as spina bifida, or open spine. And we reported that when faced with the knowledge that their child will be born crippled, over 90% of the parents are choosing to have an abortion. Well, that brought us a disturbed reaction from Joe Gallagher.
And myself, as a father of a 10-year-old son with spina bifida, was outraged because my son saw the program and began to cry because he was never told that it was this hopeless a situation. He's always been encouraged to do the best that he can.
Another reaction from a woman with a spina bifida child who, she says, has a happy and productive life. Kathleen Rawley of Holbrook, New York, felt that our report did a fine job of informing the public of the availability of this new testing procedure. And we received this comment from Ann Neville.
I have spina bifida, and I lead a very normal and productive life. I feel that if the test was available 31 years ago, I might not exist today, and that's quite upsetting to me. I'm glad my parents didn't have to make this choice.
And that's NBC Magazine.
NBC News, America's news leader.